This podcast is about promotion on the Clinician Health Sciences track and has been developed by Drs. Schrager and Sadowski in conjunction with the University of Wisconsin School of Medicine and Public Health, Office of Faculty Development. These are general guidelines for promotion on the CHS track. Over the years, the specific criteria, for example, number of letters required, for promotion may vary a little bit, but the general requirements, for example, focus, documentation of reputation, requirement of letters, will remain consistent. For the most up-to-date information, please check the CHS promotion guidelines on the UW School of Medicine and Public Health website under Human Resources. The criteria for promotion sound straightforward. You need a state or regional reputation to be promoted to associate professor and a national or international reputation to be promoted to full professor. They may sound simple, but there are a lot of details that go into how you achieve those reputations and then how you document them. Some general guidelines for the promotion process include starting early. Keep track of everything you do, no matter how minor you think it is. It can be helpful to have a working copy of your CV available for easy access so that you can write down every talk you give to residents, colleagues, or students, everything you write, no matter how small. In general, publications and presentations are the easiest way to document your reputation, but we will talk in more detail about that later. It is a good idea to try and use any work you do more than once. For example, if you give a talk to the residents, think about writing an article about it or presenting it as grand rounds or at a local conference. The requirements for promotion start with choosing your area of focus. You need to choose one area of excellence and one secondary area of significant accomplishment. The four choices are clinical activity, teaching, research, and leadership and institutional program development. Most primary care faculty use teaching and clinical activity as their areas, but different people may use any of the four categories based on their job description. In some departments, everyone chooses research as their area of excellence. Choosing an area of excellence demonstrates where you have focused in your scholarship based on your job description. To choose an area of excellence and significant accomplishment, take a look at your day-to-day activities, as well as what most of your scholarship focuses on. For example, if you do a lot of teaching and have written and presented on teaching, then that can be one of your areas. It is a good idea to start talking about this choice with your mentors early on in your career so that you have plenty of time for focusing. You need to document a reputation based on these two areas. Part of the documentation process will include getting letters of evaluation or recommendation from colleagues, as well as faculty at other institutions. These are called arm's length letters because the writers have not worked directly with you, but know you by reputation or know your work in the field. If clinical activity is one of your areas of focus, here are some examples of how to document. Being a good clinician is not enough because it is an expectation of the job. To get promoted on clinical activity, you need to go beyond that. This slide shown is a quote directly from the guidelines for promotion on the CHS track. These guidelines may change to include public health activities. The guidelines continue with some examples of scholarly approaches to clinical activity. Some examples include introduction of new clinical services, approaches, or techniques, establishment or implementation of a novel clinical or surgical technique that has demonstrated improved or more efficient patient care, distribution of updated medical or surgical approaches to other institutions, outstanding or uniquely helpful interaction with outreach community physicians or institutions, advancement of a subspecialty or particular facet of patient care in the candidate's field, and promotion of clinical trials or translational techniques that advance the frontier of care. To make a strong case for promotion, It is necessary to document a scholarly approach to clinical activity. Ways to do this include a description of clinical activities in the personal statement, published CME materials, demonstrations of clinical skills, and letters of evaluation from other clinicians who have experienced your skills. You can include any new clinical protocols or treatments that you develop in the appendix of your promotion packet. When clinical activity is the area of excellence, at least 4 letters supporting achievements in clinical activity are required, including arm's-length letters. When clinical activity is the area of significant accomplishment, at least 2 letters supporting clinical achievements are required. Letters should compare the quality of the candidate with other faculty of similar rank and experience. For many on the CHS track, teaching will be their area of excellence. Examples of scholarly approach to teaching might include development of a new curriculum, course, seminar, or workshop in undergraduate, graduate, or continuing medical education. Copies of the curriculum or PowerPoint slides should be included in the appendix of the packet. Creation of a novel or unique teaching method or materials. Establishment of a community program or partnership to further medical education. Creation of novel or unique evaluation methods or tools. And frequent invitations to teach at conferences or CME programs. Documenting a scholarly approach to teaching includes many components. The personal statement should include a description of the types of teaching that each candidate does. For example, medical student, resident, CME, community groups. Second, a summary of all teaching evaluations should be included in your dossier. You may allude to exceptional evaluations in your personal statement. This is a reason to keep all evaluations from day 1 of your appointment. You may also include in the appendix certain lectures or curricula that you have developed that you feel reflect your excellence in teaching. Lastly, your department will solicit letters of evaluation that comment on your teaching abilities. When teaching is the area of excellence, at least 4 letters supporting achievements in teaching are required. These should include 1 arm's-length letter for promotion to associate professor and 2 arm's-length letters for promotion to professor. The arm's-length letters should support the candidate's external reputation in teaching. When teaching is the area of significant accomplishment, at least 2 letters supporting achievements in teaching are required. Letters should compare the quality of the candidate with other faculty of similar rank and experience. At least 2 additional letters from former learners, for example, students, residents, or fellows, regarding the candidate's teaching are required. Online modules or podcasts can be used to demonstrate a scholarly approach to teaching as well. It is possible to measure how many people have viewed a podcast or module online, which can further demonstrate your reputation. The requirements for research as an area of excellence on the CHS track are different than that on the tenure track. That said, to get promoted on the CHS track using research as the area of excellence or significant accomplishment, you need to demonstrate that your research is meaningful to your discipline. This can be accomplished by publishing your research, demonstrating that the papers you write are cited in other literature, obtaining grants, and getting invited to speak at meetings in your field. To be promoted to associate professor based on research, you need to demonstrate a state or regional reputation, and to be promoted to professor, you need to document a national reputation as a researcher. Evidence of excellence or significant accomplishment in research can include a description of the research in a candidate's personal statement and a bibliography of papers published. This bibliography should be annotated, including a notation of how many other papers have cited each of the publication, a statistic that can be obtained through several websites, including Google Scholar. You should also include a list of grants with the peer review summaries of these grants included in the appendix of your promotion packet. Description of research committee memberships is also important to include. Lastly, letters of evaluation are important to demonstrate your reputation for excellence in research. When research is the area of excellence, at least 4 letters supporting achievements in research are required, including arm's length letters. The arm's length letters should support the candidate's external reputation and assess the quality and productivity of the candidate's research, but should not be from collaborators. When research is the area of significant accomplishment, at least 2 letters supporting achievements in research are required. Letters should compare the quality of the candidate with other faculty of similar rank and experience. Getting promoted using leadership and program development as one of your areas of focus must demonstrate exceptional service or leadership. The promotion guidelines make sure to note that, quote, committee membership, professional service, and administrative duties are expected of all CHS faculty, and routine activities in this area do not meet the criteria for exceptional leadership as a basis for promotion. Examples of a scholarly approach to leadership might include leadership in professional service organizations such as medical charities and/or patient advocacy groups, leadership roles in major departmental, medical school, hospital, or university leadership roles, including roles on major committees, professional leadership in local, state, regional, or national service or government units, present and past appointments or election to office in county, state, or national medical and healthcare societies, and the creation or development of a program with clinical presence deemed critical by the medical school or hospital. Documentation of a scholarly approach to leadership in service, administration, and/or institutional program development should include a description of the program and position in the candidate's personal statement, an organizational chart of the program demonstrating the position of leadership of the candidate, presentations or published material on the subject, and letters of evaluation. When leadership is the area of excellence, at least 4 letters supporting achievements in leadership are required, including arm's length letters. When leadership is the area of significant accomplishment, at least 2 letters supporting achievements in leadership are required. Letters should compare the quality of the candidate with other faculty of similar rank and experience. All candidates for promotion need to write a personal statement that addresses their area of excellence, significant accomplishment, and other aspects of their job. The personal statement should start out with an introduction with a background about you and your philosophy of medicine, teaching, research, or leadership. The philosophy does not have to be very sophisticated, but you do want to explain why you do what you do so that the committee reading the statement has a context in which to evaluate your accomplishments. Next, you want to describe what you do. You want to start with your area of excellence and go into detail about your accomplishments within this area. For example, if clinical activity is your area of excellence and you developed a new algorithm to treat people with CHF in the hospital, you want to give a little background, why you developed the new algorithm, why it is innovative, and what the outcomes have been. If teaching is your area of excellence, you may discuss a program you developed for medical students to learn about care of the underserved. You would include the curriculum, the evaluations, etc. In the 2 above examples, you can see how, while you are describing what you do, you are also demonstrating the uniqueness of your accomplishments. The personal statement should also cover the area of significant accomplishment in some depth, and then review the other areas as they pertain to your job. If clinical activity is either your area of excellence or significant accomplishment, you should outline your job description, how often you see patients, in what venue, what is your scope of practice, and other details that you deem important. You want your personal statement to be detailed enough that the reader gets a sense of who you are and why you do what you do, but it is not a personal essay. You do not have to disclose personal information or too many details.